excerpt.
Dr Ginni Mansberg, thanks very much for your time. Now, we've been bombarded with information about swine flu over the past week, but I suppose that's not really unusual when we're dealing with a sudden outbreak like this, and people are nervous.
Yeah, they're really nervous about it. And of course, we don't know that much about it, so we're grabbing little bits of information from here and there and trying to piece it all together, and it's making a really complex quilt.
Well, as a GP, what's been your experience? Are you seeing many people coming in worried about it?
Yeah, I call it swine anxiety, and it's absolutely everywhere. Really, at least for all of myself and all of my colleagues, we're at least seeing about 5 to 10 patients a day who are very fearful of having swine flu themselves.
Now, I would imagine that the majority of those people don't need to be worried. I mean, we're seeing an overdose, aren't we, of panic?
Absolutely. I mean, we're seeing people who have travelled, for example, to Sweden a month before, now have a sore throat, are very concerned, and of course that's not a worry whatsoever. I haven't even done one test for swine flu yet, let alone confirmed a case.
So what is the criteria that would engage you into a test? I mean, who should be worried?
We know that the incubation period is about 7 days. So if you have been in an area where the pandemic is full on, for example, Mexico, within the last 7 days and you develop symptoms, that's tick number 1. Tick number 2 would come from the symptoms themselves. And of course, we are just not seeing anybody getting swine flu without a very high fever. And when I say very high, it's 38 and over. And of course, all the other flu-y symptoms that we expect: sore throat, a cough, aches and pains all over the body, stiffness, sometimes a runny nose, but not necessarily, and similarly with abdominal symptoms. Sometimes we're seeing some diarrhoea and tummy cramps, but not all the time.
We don't know yet, though, how far the disease may have spread in Australia. If you're somebody who does have a severely high temperature and these sorts of symptoms, but you haven't travelled recently, does it pay to be cautious? I mean, is there any cause for concern?
There is cause for concern because that's a flu, and anyone who's had an influenza as opposed to a cold, when you really do feel run over by a truck, you know how absolutely dreadful you feel. And influenza, whether it's swine flu or any other form of influenza, is a nasty illness. It still can make people very sick and even kill them. So absolutely go to your doctor if you feel that you have an influenza, whether you're worried about being swine flu or not, because there is treatment available.
Well, as you've just mentioned, a normal case of influenza can kill, but how much more dangerous is swine flu?
Not at all. As far as we can tell, it seems to be no more dangerous than a normal influenza. We think the reason why it's caused so much damage in Mexico is just because their health system is not as well developed as that we have here in Australia, or for example in the United States. But otherwise, it's a pretty fairly stock standard flu.
So what you're saying is, I mean, the Australian government has said that they're probably fighting a losing battle by trying to prevent the disease from spreading here. You say if that does happen, if there is, for example, a mass outbreak, it's manageable in Australia.
It's manageable for a number of reasons. First of all, we know that this particular flu is responding to the main anti-flu drugs that we have here available in Australia, and they are Tamiflu, which is a tablet that you take twice a day, and Relenza, which you inhale. Now, the swine flu is responding very well. So number 1, we have treatment, and number 2, when people are getting very sick, they're dying from respiratory problems, from lung problems. Our hospitals are very well equipped to deal with people with respiratory problems. I can't imagine we're going to see anything like, mass numbers of deaths the way we did in 1918 when we had a mass influenza outbreak.
Well, let me ask you on that. Statisticians have said that the world was due for another influenza outbreak. Are you saying then, was the medical community, if not expecting this, very well prepared?
Very well prepared, and increasingly well prepared recently. So as you said, we've been waiting for another flu epidemic to come, and in fact the Australian government convened a task force to look at influenza, to look at what we would need in the outbreak of influenza, and has stockpiled Tamiflu, the anti-flu drug that's available. They've stockpiled that for just such an epidemic, and have a whole range of policies available to help prevent the spread of the disease the way it did the last time we had a massive flu outbreak.
I understand that our antiviral stockpiles are somewhere around the 8 million mark. Is that enough?
It should be enough. We really, for half the population, or a third of the population of Australia, to go down with this flu, and to have it badly enough to actually require active intervention with an antiviral, we're really talking about a nasty epidemic when no one thinks it's going to get that bad.
Well, we've also heard a lot this week about face masks. They're popping up all over the place. You can get them online now at the drop of a hat. How effective are they? Because I've heard that some of them don't really work at all.
Yes, not very effective. The studies are really not getting behind them at all. And as you say, there are very cheap ones you can get from sort of $2 stores, and then very expensive ones you can get from hospital equipment stores. They're pretty good if you have the flu and you don't want to spread it to anybody else by coughing and sneezing all over them, and you can't be bothered putting your hand in front of your face every 2 minutes. But in terms of avoiding catching it, well, you really need to be very, very diligent. You need to keep washing your hands obsessively, and you need to never take the mask off, which is pretty difficult if it makes you feel claustrophobic or if you want to do bizarre things like eat or drink.
What about general daily activities, shopping, catching a bus? I mean, how worried should the everyday Australian be when just going out in the community?
Not in Australia. Not now, and we don't know whether that will happen at all, because there's just not enough of this virus load in our community for any of us to be worried at this stage. Certainly in Mexico, they're taking a far different stance, and they've, as you know, shut down schools and a lot of other public institutions, and have told people to avoid being in public areas where there is likely to be a lot of circulating flu.
What about the antiseptic hand washers? I mean, I've heard they're quite effective, but a lot of people have started using them. Is that a little excessive at the moment?
I don't think it's excessive at all. I think they're really fantastic products. If you were to go and do the full surgical scrub and get your hands under the tap and scrub for 3 minutes and get under your nails and make sure your thumbs are done, hand washing is absolutely adequate to kill every bacteria and virus in the environment. But of course, none of us really do that. And an antibacterial hand wash has all the ability to kill a lot of bacteria and viruses in a very quick and easy way. You can carry them around with you in your handbag, you can have them on your desk at work. It certainly does help prevent that hand-to-mouth transmission, which is one of the ways in which swine flu is spreading.
All right, well, in order to protect the pork industry and to prevent the slaughter of animals, the World Health Organization has moved to change the name from swine flu to influenza H1N1. Can you first tell me, how did the disease get the name swine flu, given that pigs can't even catch it? And who decides what a disease like this will be called in the outset?
Well, that lucky break got given to the Centre for Disease Control in Atlanta, Georgia, in the United States. They seem to be the ones who are on top of the game of discovering new virus strains. They looked at that one that was coming in from Mexico, stuck it under an electron microscope, and hey presto, found that it had a lot of DNA that was very similar to real swine flu, flus that circulate amongst pigs. And they realised that this had originally started in pigs, in swine. And we know that the original cases in Mexico had popped up in people who were caring for pigs or lived in very close confine with pigs. Somehow the virus managed to mutate and go from the swine to the human. That's highly unusual. Well, it's continued its march of mutation, and now swine can no longer actually even catch it anymore. The name swine flu got out into the community. It's very easy for newspapers to stick it on a headline. I think it's caught. To try and stop that now is like really, the train has left the station. Good luck to the World Health Organization for trying.
Well, we know that some specialists are working around the clock to develop a vaccine. Would you say that one is imminent? And if so, when will it be released and how will it be distributed?
Unfortunately, the experts are still saying that it is a good 3 to 6 months away. Would it be an independent vaccine separate from our influenza vaccine? Probably not, because if it comes in another 6 months, it might be too late to have any really good effect on this particular outbreak. What they would probably do is use that vaccine as one of the strains of influenza that we immunise against in the influenza virus, influenza vaccine that is given to people every year. We always take 3 strains of the influenza virus that are circulating in the world at the moment and inoculate against those. It is a bit of a punt, but they probably add that to the flu vaccine for next year.
Well, just finally, Dr Mansberg, short of perpetuating swine anxiety, if somebody does have any concerns, what would you recommend they do?
The first thing to do is not rush to your local hospital or to your local GP. Stay calm and stay at home, because if you really do have it, you don't want to be spreading it to everyone else. get on the phone and ring your local GP and get some advice. One of the bits of advice you might get is to stay at home until the symptoms get a little worse, or you might get asked to come into the GP, but you'll get put in a separate room so that you don't spread it to others. Of course, if you decide to rock up to your GP or to the accident emergency, make sure you make it very clear that what you think you have is the swine flu, so that they can take the appropriate procedures and isolate you from all the other patients in the waiting room.
All right, Dr Ginni Mansberg, thanks very much for talking to us about it.